Hola, soy la doctora Watts. Hoy quiero hablar sobre la cosa porque es muy importante para saber o aprender cómo de hablar en español con sus pacientes. Hello, I am Dr. Watts. Today I want to talk about how important it is to learn how to talk to your patients in Spanish. Una cosa importante para aprender cómo de hablar con sus pacientes en español es más fácil si la primera cosa aprende es las preguntas, se puede preguntar y sus pacientes se puede contestar sí o no. Es más fácil en esta manera cuando está esperando para un intérprete. O si se puede conducir todo el interview en la manera en español. One of the easiest ways to learn to interview patients in Spanish when that is not your native language or you haven't taken a formal lesson is basically to learn the questions that are commonly asked in the environment or setting that you'll see patients in, and the patients can answer easily yes or no. An example of one of these questions is, do you have pain? En español se puede preguntar, ¿tiene dolor? O ¿usted tiene dolor? That is, do you have pain? Or formally, or just question of, do you have pain? Otras cosas, como de si tiene fiebre, si tiene tos, si tiene problemas de su cabeza. Other questions are, do you have fever, do you have cough, or do you have any problems in your head, which is pretty much a headache is what you're asking. These questions are easier because the patients can just answer yes or no. So commonly, if you're encountering a patient in the emergency department, some of the common questions, of course, are going to be fever, pain, chest pain in particular, headaches. Those are some of the common questions. So those are places where you'd like to begin your lesson, and it's kind of a crash course on how to speak Spanish or some of the common things that you're going to encounter with your patients. If you're learning to see a patient in an outpatient setting like a clinic, more common questions are going to be your diet, the patient's diet history, exercise history, if there are any family history, which are questions also you'll ask in other areas. However, these are going to be more common to the outpatient setting depending on the patient's presentation. Otras preguntas que necesita saber si está en una clínica son su dieta, cómo está su dieta, normalmente está bien o normal o está comiendo comidas especial, o si se puede preguntar, ¿tiene una historia en su familia de condiciones o problemas médicos? En muchos pacientes, si usted se puede hablar en español un poco, va a ayudar mucho. With a lot of patients, even if you speak a small amount of Spanish, it helps a lot. Muchos de sus pacientes se pueden hablar en inglés a veces. Entonces, si usted se puede hablar tampoco español y tu paciente habla tampoco inglés, se puede comunicar las cosas que necesita. A lot of patients will speak some English, and therefore if you speak some Spanish and they speak some English, you still may be very effective at communicating with each other. Es importante para tratar de aprender el mismo idioma de su paciente. It is really important to try and learn the same language as your patient. Pero para estar seguro, las palabras, las cosas se están hablando, es importante, están claro, es importante para ustedes entienden bien. It is really important that you both are able to understand each other. So if you are aware that there are some areas that you cannot communicate with your patient, it is important to get an interpreter. Si usted nota no puede hablar bien con su paciente de cualquier idioma, es muy importante, se puede llamar un interpreter. Often, the institution that you are at offers interpreter services, either in person or by telephone. Muchas veces el hospital o otro lugar que está trabajando usualmente que tiene un servicio de interpreter. Es posible es una persona o es del teléfono. When we talk about interviewing special populations, it is not only just populations that speak a different language than you, but you also have to consider pediatric patients a special population, OB patients are a special population, and that is because in pediatric situation, you do have a parent who is typically going to speak for the child, depending on the age of the child. In a pediatric setting, it could be for infancy, which of course you're going to get the history from the parent. In childhood, often you can get the history from both the child as well as the parent, depending on the age and the child's ability to communicate. And then in adolescence, it's very important in order for you to communicate with the adolescent and the parent together, and then separately. If you choose to interview the adolescent alone and you choose to interview the parent alone, it's really important for you to interview the parent alone first. So you'd want to interview both the parent and adolescent, then excuse the adolescent and have the parent sit for the interview so that you can ask the parent, are there any particular things that the parent would like for you to bring up with the adolescent? And it is an opportunity for the parent to speak freely about any concerns that the parent may have with the child regarding physical, emotional, mental, or any cognitive development. After that, you bring the adolescent in to be interviewed alone without the parent, and you can use that as an opportunity to discuss confidentiality as it applies to the adolescent, also based in the state you're in, and let the adolescent know that everything that the patient tells you is confidential to you all together, although you should encourage the patient to want to be honest with their parent. So you interview the adolescent, you do your exam with the adolescent. You should offer to have the parent return for the exam if the child is comfortable with that, or if it is a adolescent that is an opposite sex adolescent, you should also have a chaperone in the room if the child does not choose to have the parent in the room with you. Subsequently, you have the parent return to the room after the exam is completed, and you all can discuss overall plan of action. If there has been something confidential that the adolescent has discussed with you that they do not want to disclose with their parent, then you should discuss the assessment and plan for that particular issue with the adolescent prior to the parent returning to the room. Of course, in terms of confidentiality, there are some limitations to it. If there are cases where there's a concern for a risk for suicide, homicide, or any other risk of harm to someone else or the adolescent, then you may not be able to maintain confidentiality without having to take a plan of action on those particular activities. Some of the other clinical skills that are really important to know and practice, not only for testing, because of course it will be tested in your clinical skills exam, but also just in practice. These are things that you should do with every patient in every setting as a provider. So always knocking on the door prior to entering is important. Always washing your hands prior to touching the patient. I personally prefer to wash my hands in the room so that the patient can see that I've washed my hands. and then also to wash your hands again after completion of touching the patient. These are things that are going to be very important when you're being graded as clinical skills, as well as in your everyday life in terms of patient satisfaction. You always want to verify the identity of the patient, usually by using 2 patient identifiers, which are often name and birth date. Also, if there are additional persons in the room, you want to know who they are and how they are related to the patient. Do not hesitate to ask, you can ask the patient, oh, who is this or this person is, or you can ask the person directly and ask them what is their relationship with the patient. And if there are any sensitive items that need to be discussed or sensitive exams, you always need to ask the person to step out of the room, or ask the patient if they would be more comfortable with the person in or out of the room. Wrapping up a patient visit, at the end of the visit, patients should always know and understand what the upcoming plans are and what the follow-up would be. What is your assessment? So give them a summary of the visit, and make sure that what they are concerned about and what they want addressed those things are addressed. So you want to make sure you let the patient know, so this is what I've heard today, this is what I've seen on the exam, so this is what I'm thinking. And my plan for what particular condition, situation that you are encountering is going to be this. And you let that patient know. And also, if there is or isn't any other follow-up for that particular issue, you want to be clear to the patient as to what the follow-up is going to be. So if there is an issue that needs to be followed up, okay, I'll see you back in 1 week, 2 weeks, 1 month, whatever time frame. If that issue is resolved, then let them know, okay, well then I'll see you back in 3, 6 months, 1 year for your regular checkup, or for your next set of laboratory tests, or your next set of images, if that is the case. So you always want to wrap up the visit, again, by summarizing what has transpired the entire visit regarding your patient's concerns, what you've picked up on physical exam, and any results of any studies or interventions that you have already done. Make sure the patient knows and understands what the follow-up plan is, what expectations are, if any new medications have been given, exactly how to take those medications, and when you all will follow up to assess the effectiveness of those medications, or just whatever next steps are going to be, whatever the next steps are going to be. And if it is at all possible, you need to give the patient as much handwritten information, not like an entire packet, but enough handwritten information so that they can read it when they're home and refer back to it, because oftentimes questions will come up later about information they have received already.